First, we have to consider the difference between sadness and depression. And we, as parents, I often say to parents, you know your child best. I know your child for 7 hours a day at school, Monday through Friday, and I've only known him for X amount of years. A parent, and I really defer to the parent to know the kid best. So what's the difference between sadness and depression? There are three key things that we're looking for. We're looking for a feeling that continues and doesn't go on. So we often talk about persist. So persist means it lasts longer than 2 weeks and the child can't shake it off. If we were sad, we might feel sad for a couple hours, maybe a day or two, but we're not consistently feeling sad for over 2 weeks most of the time. And the other part is that sadness so severe that it's interfering with the kids functioning day to day, their ability to concentrate at school, maybe a teenager who has an after school job and continues to forget their schedule or is just not taking care of their physical self. So those are the major things we think about. So we think about persist, it lasts longer than 2 weeks, the kid cannot shake it off, and it's interfering with the day-to-day functioning. So that's the general ideas. Now let's break it down in a little more details. Often we will see changes in eating, sleeping, but it could be either one of two ways. It could be they're eating a lot or they're not eating at all. So it's not one way or the other. It's just different for them. My child used to be a great eater and now they're not eating at all. Or my child was a very selective eater and suddenly they're eating everything in the refrigerator. And that's barring a growth spurt because that's part of what you would expect in a growth spurt. But anyway, so changes in eating, changes in sleeping more than usual or not at all. Mood changes, just this feeling of gloom and doom, anything that they say tends to be very negative. Changes in grades, for example, changes in social relationships, them not picking up the phone when their friends are calling or not responding to a video chat, not wanting to be around their friends at all. With older teenagers starting to give away things that are very important to them. So a prized collection of something, suddenly they start giving it away. So these are kind of goodbye signs. And then increase in use, substance abuse, drugs, alcohol, and then either suicide attempts. Obviously, the ultimate is suicide. And we have seen some increases in suicide as well, given COVID, even in younger people. But those are all these signs. So if I'm talking and you're thinking, wow, there's 2 or 3 of those things that apply to my child, what should I do next? You know your child best. You know if you need to start with a conversation or if you really need to take it to the next step, which is, let's say they're in school for in-person instruction, calling a teacher that knows the child well and saying, hey, are you noticing these changes in my child too? To the next level, maybe an appointment with the child's pediatrician, or in situations of extreme emergency, we've again listed some mental health numbers, but really in case of emergency, calling 911 when you don't know what to do. So again, to my analogy of the temperature and figuring out what is it that's driving that anxiety, what is it that they're worried about so that we know how to address those situations. Oftentimes when we think about anxiety, it's the idea that we've lost some control. And so we're trying to find ways to exert some control. It sounds kind of odd, but for example, you know that you have no more control over if you're at school in person or online. That choice has been taken away from you as a child. There are certain measures that have been taken that remind you of the presence of COVID, the masks, the face shields. In some classes, they have plexiglass shields on top of the desks. So all those cues are reminders to children sometimes that they've lost control. So what do we do to empower them again with control? So what are the things that we have control over? As adults, we're models for them. And really at this time, what we have control over is one day at a time. If we start thinking about what is my life going to be like in 3 months, in 6 months, in 1 year? It is a scary perspective because we don't know where this pandemic is heading. But we know what we could do now. What are the things that you are doing now to keep yourself and your family safe? So when we use these masks and the hand sanitizer and the hand washing and the social distancing, reminding the children that these are all things that they do to exert control to diminish the risk of getting the virus that causes COVID. That's part one. So we're modeling for them. I have control over what I can do today. These are the things I can do. Rituals are very important at this time. So hygiene rituals, what are the things that you do to get, for example, if you're going to school, what are the things the kid is doing to get ready for school? Or when they come home from school, what are the things that you're doing at the end of the day? I have noticed at my school that a lot of teachers are wearing scrubs now because they're using the scrubs, and as soon as they get home, they're showering, changing. And that gives them a sense of, I have some control. These are the things that I'm doing to keep myself safe. So rituals, whatever rituals you're doing with your child around hygiene are important. So those would be some of the things I would think about with anxiety. And again, just like I talked about with depression, if things are getting to the point where it's been going on for longer than 2 weeks, your child cannot shake off that feeling, and it's interfering with the day-to-day activities, then it's time to ask for some help.